All right, well, it is 12:02. I'm sure others will be joining us. I think it's okay for us to get started here. I just want to welcome everyone, all of you for joining us here today as we start our second Impact Tour with the Healthcare Network. I'm Alberto Huerta, Senior Director of Investor Relations at United Way of Racine County. I have the pleasure of being here with all of you. As we learn a little bit more about the collective efforts and the work here in Racine County in our community, thanks to donors, volunteers, partner agencies, other community partners like you all. So today we have the pleasure, as I mentioned, to speak and hear from Allison Sergio, who is the Executive Director of the Healthcare Network. Good afternoon, Allison.
Good afternoon, everyone.
So the purpose and kind of the outline of today's Lunch and Learn, we really hope that all of you joining us today leave with a better understanding and see firsthand the impact of the day-to-day work of United Way and funded partner programming and how organizations like the Healthcare Network live united by fighting for the health, the education, and the financial stability of everyone within our community. I'd like to share a few things before we kind of get into the Q&A with Allison. This 30-minute Lunch and Learn will be recorded for your viewing, pleasure starting next week. So we'll be posting that to our YouTube page. And then within the month of August, we'll have a designated webpage on our United Way website that you can visit to see past impact tours and upcoming impact tours as well. We do encourage questions, so feel free to drop any questions as we go through the Q&A in the chat box. Tracy will be tracking all of the questions and will present them at the end with the Q&A portion. Or feel free to save your question and unmute yourself at that Q&A portion at the end. Otherwise, we do ask that you keep yourself muted throughout the presentation until we get to that Q&A portion. Does anybody have any questions or anything before we kind of get started? If not, I think we'll jump right into it. So we have a series of questions here that we have created for Allison to really help explain the work that she does before we get into the actual tour of the Healthcare Network's facility and kind of where they do all the work. So with that, Allison, can you share what the Healthcare Network's mission is?
Absolutely. First, I want to say it's a pleasure to be here talking with everybody today. I love to show off the Healthcare Network, and so I'm so happy to be able to do that. And there's no better time than during a pandemic to talk to people about what a free clinic does and the service that a free clinic has for the community. So I'm happy to be here. So the mission of Healthcare Network is to provide medical care, dental care, and behavioral health services to the low-income, uninsured residents across Racine County. And so that means at 250% of the federal poverty line or below. And for those that don't have insurance and don't qualify for insurance, we're here to help meet those needs, those medical needs. We do have 32 different specialties of medicine and 5 different specialties of dentistry. All of our services are done in English and Spanish, and we do have an employed on-site Spanish-speaking therapist available for our patients as well. So we're that safety net for those who do have insurance, between those who do have insurance and those who don't have insurance. We're that safety net to be able to provide those services for that population.
Great. Do you mind sharing how long you've been a United Way of Racine County partner or funded, partner, and kind of what's the benefit to collaborating with United Way?
Sure. I actually tried to look that up and I could not find it. So that means that we have been a partner for a long time with United Way of Racine County, longer than our financial records go back. So I've been here since 2014. And prior to that, we had been a partner for at least 10 years, if not longer. So many, many years of partnering with United Way of Racine County, and we're so thankful for that. You know, I have to say that the biggest benefit that an organization gets in a partnership with United Way is that as a United Way agency, you are vetted by United Way. So we have to prepare a proposal, and there are many different questions and many different sort of a rigorous test of your program to see how well you understand your program, the needs of the community, your financial situation, how well you'll use those finances. And we have to submit a proposal and then report on that several times a year. And so all of the United Way agencies are vetted and and you can be sure that they're using the money appropriately. So I think that that's sort of the biggest badge of honor, is telling people that you're a United Way agency. In addition to that, when I go out and talk about Healthcare Network, it is every single time I'm always asked if we're a United Way agency. So United Way, again, has that badge, that clout in the community, and to be an agency that is affiliated with United Way is just sort of a badge of honor. So I'd say that's the biggest. I do have to say also, during the pandemic, United Way was instrumental in figuring out what, especially some of the smaller organizations needed, and gathering those resources and then getting those resources out to those that needed it. During the pandemic, we've all been running around like chickens with our heads cut off. All of us have. And the best use, I think that United Way staff found that the best use of their time was to collect those resources and be able to get them out to their partners. So that was amazing also.
Yeah, thank you for mentioning that. And I think, you know, we couldn't do it without the support of the community and donors that really did step up to that call to action to really help, you know, not only United Way, but again, you know, funded agencies around the needs due to COVID. So yes, so thank you to all of you here today who are, you know, supporters and donors. So next question here. When a donor donates to United Way of Racine County, approximately how many Racine County residents are impacted by the support of a donation? Or, you know, how many people are you seeing or serving
with those dollars?
Yeah.
Well, so Healthcare Network works a little bit differently. It's hard to say how many people that impacts. I do have a number, but let me explain this part first. It's hard to say how many people that impacts, because if you think about it, there are certain people that go to the doctor once a year and that's it. And other people that might have a chronic disease or a chronic oral health issue, and they need to be seen on a more regular basis. So instead, we do count the number of people that we see and unduplicated people that we see, but it's a better and more accurate count if we show how many appointments we have provided through the agency. So in the last year of service, that being July of 2020 through June of 2021, we served 2,212 unduplicated patients. So about 2,000, a little more than 2,000 patients annually is what we look at and what we serve. And we exceeded our goals and provided over 6,800 appointments during this year, which is the most amount of appointments that we have provided since the Affordable Care Act was enabled. So it just really goes to show that even when we had more of a skeleton crew, a bare bones crew for staff, some of our volunteers stepped back during the pandemic because it wasn't safe for them to be seeing sick patients. Even with those barriers in the way, we ended up providing more service during the pandemic than we had previously. And we do also like to say that for every dollar donated to Healthcare Network, we're able to turn that around and provide about $5 on average of services. So it's a pretty good return on investment.
Great. Can you maybe explain a little bit about, the volunteer aspect of it, right? So like the dollars that are donated goes to programming, right? So you have a number of volunteers who are volunteering their time, experts, right? Doctors, dentists. Can you explain a little bit more about that and how that works?
Sure. All of our services are provided by volunteers throughout the community. So doctors, nurses, medical assistants, physicians assistants, dentists, hygienists, etc. That is the bulk of our service. So they provide all of that service for us for free. The remaining amount and the balance of the work then is provided by the staff members, and that is coordinating all the care. So for instance, when a patient comes in, we screen them to make sure that they qualify for our services. You'd be surprised at how often a patient walks in and has an insurance card in their pocket and they just don't know how to use it. And so what we do is take them through that process, help them get set up with a primary care provider, and do a little education with them on how insurance works. And that's a big piece of what we do. But if they don't have insurance and they don't qualify for anything, then they become a healthcare network patient. And that's all done by our staff. They screen them, do the intake process, and then they'll get them set up with a primary care provider. Now, each of our volunteers lets us know what they are willing to give us. So they'll tell us, I'll see X number of patients a week, a month, a year. I'll see these kinds of patients. I only want to be a second opinion. I do want to do primary care, but I won't see these patients. All different, what they will do and what they won't do with our patients. And we coordinate all that. So we are the ones that the patient would call us to schedule an appointment. We call the provider to schedule that appointment for the patient. And the reason that we do that is because we need to track how many of our patients are being seen, what they're being seen for, and making sure that we're making best use of our volunteer time and seeing patients within their parameters and their guidelines that they set forth. One of the reasons that our volunteers like to come to Healthcare Network and volunteer is because our staff really do all of the work. All the volunteer needs to do is sit down, do what they do best, see that patient, and everything else is taken care of. So if they need to make a referral, that's taken care of by our staff. They don't have to worry about making appointments or finding out where patients are, getting lab reports. All of that is taken care of by us. So again, the bulk of the programming is taken care of by our volunteers, and the money that we use goes to pay, in large part, the vast majority of it goes to pay for our 12 staff people that coordinate the care of the about 300 volunteers with the 2,200 plus patients.
Great. Can you share, as far as services, are all services provided here at the Healthcare Network facility, or is it also other locations? Can you explain a little bit about that?
Yeah, so Healthcare Network is named network because we truly are a network. And so we have two physical locations. We have the location in downtown Racine on Wisconsin Avenue. And then we also have a location on the west end of the county in the Aurora facility out in Waterford. And we have an office there. And that is a satellite clinic, and they're in operation about 2.5 days a week out on the west end side of the county. The volunteers are given the opportunity to either practice in one of the two sites. Some of them practice in both of those two sites, or they're able to practice in their own facility, and we send the patients to them. So we'll schedule the appointments and send patients to their offices. So effectively, we have locations all the way across the county, and we do our very best when we find somebody who might be in Union Grove, for instance. We do our best to make sure that we set them up with a provider that is in their area and that would meet their needs. So sometimes that becomes tricky because we don't always have all volunteers in all areas, but we do our best to make sure that we can provide the services in knocking down as many barriers as possible. With that said, we do have patients that do travel from one side of the county to the other. So for instance, on the west end of the county, we're just starting to make some breakthroughs to get some dental services out there, but it's been slow going. We have lots of dentists available and dental services available on the east end of the county. So we do have patients that will travel and will be seen on the west end for medical care, but they'll come in to Racine or one of our partnering agencies that might be on the west end of the community to be seen there. So our patients do travel when they're able to, and then we work with them to do that too.
Nice. Quick question about the patients that you are seeing. Is it a walk-in process, or do they need referrals? How does that work?
So they do need to be a patient of ours. So we're not a drop-in clinic or a same-day clinic or an urgent care center. We can't see patients on the same day, typically speaking. Although if somebody comes to us and does have an emergency, we do our best to get them taken care of, even if they're not currently a patient. So we do really try to work with that. But typically a patient will come to us and make an appointment to be screened and make sure that they qualify for our services. And then they would set up, even if they didn't need a medical appointment or a dental appointment, we try to get them set up so they can establish care and be seen with that provider, because we really do, it works very similar to a regular medical clinic. We really do try to keep you with your regular medical provider for as long as possible, unless you have an emergency or you need to see a specialist or something like that. So yeah, we're not necessarily a walk-in, although we do receive lots of referrals from the urgent care centers, from the emergency rooms, from Ascension and Aurora, and some even from Freighter, for people that have presented in their area at their organization and might be a good fit for Healthcare Network.
Great. And then, so, right, we had a troubling year for many people, lots of obstacles. Can you share maybe a milestone or an accomplishment for the Healthcare Network within the last year?
Yeah, so this is my favorite question, and I'll tell you why. We had what you can imagine, it was a kind of a chaotic year. I mean, every day there was something new with COVID, and we had to be on those front lines because we had people presenting in our office with COVID, and we only have a staff of 12. And if one of us goes down, it was probable that we would all go down. And so we were looking at ways to really keep all of our staff safe so that they could continue to provide services. And so that was a day-to-day obstacle, a day-to-day barrier. However, I do have to say that the community, while it was true that some donations and some organizations experienced a slowdown in donations, the community really came together and supported Healthcare Network and said, this is something that we need to have happen. So I always say that we could be easily the best kept secret, right? You don't necessarily see these patients. You don't know walking down the street who has insurance, who doesn't have insurance, what their income levels are, if they have a medical provider or not. And it was highlighted during COVID when we had the stay-at-home orders that, hey, people are scared and sometimes showing up in the emergency room inappropriately, meaning they were scared, they might have symptoms, or just terrified. People were isolated and terrified, and were showing up at the emergency rooms and the urgent care centers. And we got a call saying, you guys are open, right? Because we need to shuffle some patients around. And so at that point, it was highlighted that Healthcare Network is really a true need in the community. I have to say, some of the things that we had done, we wrote a couple of grants and received some funding to be able to have an on-site dental hygienist. So that was amazing. We were, as a partner with the Wisconsin Association for Free and Charitable Clinics, and the only free clinic in Racine County, we were awarded funding to be able to provide telehealth services. So we now, like you can at your doctor's offices, we now can provide telehealth services in a three-way call. So we can have an interpreter from Healthcare Network on the call. The volunteer can be in his or her own office or home or vacation spots. And then the patients can be at their own home too. And we're able to provide services that way. So that has been amazing. In addition to that, we worked really hard and met the goal. We were awarded the gold level for standards of excellence with the Wisconsin Association for Free and Charitable Clinics and the National Association for Free and Charitable Clinics. So we really were able to pull our processes together and really look at what we had. And I think just we strengthened our partnership definitely with United Way, with Ascension, with Aurora Healthcare, and some other community agencies that where we just really found that, you know, we were just all chugging along, and then this COVID thing got thrown in our laps, and we found that in order to actually meet our mission, we had to work together. And I think that was very common, and it was very prevalent, and the mindset was that way. So we really forged a lot of new partnerships and strengthened some old partnerships. It's actually not that I wish the pandemic happened again, but a lot of good things happened for Healthcare Network during that time.
Yeah, a lot of things you should be proud of. So yeah, those are some great accomplishments. Good to hear. So I have one last question before we jump into the tour portion. What is the best way that anyone in Racine County can help support the Healthcare Network, whether it's immediately, like now, or in the coming months?
Absolutely. So the very first way is that you all have some sort of affiliation with United Way and continue that affiliation. United Way is doing great things in the community, and they are fulfilling their mission to help support the nonprofits in the community. So that would be the number one way. In addition to that, we could always use different volunteers, and we always have volunteer opportunities available. So obviously we have opportunities available if you happen to be a doctor or dentist or in the medical profession or dental profession in any way. But we have rotating opportunities that are available also. So the first thing is that we're just switching over to an electronic dental record, and that comes with a lot of tripping up, as I'm sure people can relate to. But the number one thing that we have to do is backload dental records into the new system. So we could use some office help with somebody helping us scan records and get those uploaded into the new system. That would be helpful. Otherwise, calling Healthcare Network to ask us what other volunteer opportunities we have. Those change on a rotating basis. And so if anybody's interested in volunteering, please give us a call and let us know. Another piece of what Healthcare Network does is that we provide medications and things like toothbrushes and toothpaste and dental floss for our patients. We help them provide those for our partner. For if we have to write a prescription, we work with a couple different pharmacies that help provide those medications at a decent price for us and for our patients, so that a big piece of our budget goes to help provide those medications. But we oftentimes need over-the-counter medications, Tylenol, ibuprofen. During cold and flu season, we need those over-the-counter cold and flu medications, which can be kind of costly for our patients, but yet not a prescription. In addition to that, we always want our patients to leave with a toothbrush, a toothpaste, and floss, just like when you go to your regular dentist office. And so we're always taking donations of individually packaged, soft bristled toothbrushes, small little toothpastes, and floss, so that we can give those to our patients to help promote the proper dental hygiene. So there's lots of different opportunities that we have, and those change on a regular basis. So feel free to give us a call, look on our website, or stop on by and take a tour of the clinic too.
Great. So we're going to transition into the tour portion right now. So bear with us. It's a short transition, and we will see what the Healthcare Network has to offer.
Hello, everybody. I'm back again. Okay, so I wanted to give you a tour of our new site. Some of you may know that in August of 2019, so it's been about 2 years or so now, we moved into this current location right on the corner of 5th in Wisconsin. It's been a wonderful transition for us. Our old location was a little bit run down and was not as functional for us as we needed. And so we were able to start a capital campaign and build this new location, which has been wonderful for us. So currently you are looking, I'm standing in our waiting room. And when you come into Healthcare Network, you'll see we have a front counter, just like at a regular doctor's office. And the desks here in the front are our health, what we call our healthcare coordinators. And those are our workers that answer the phone, check patients in, check patients out, make sure that all of their medical appointments coming up are made, and sort of handle anything that the patients coming into Healthcare Network would need. So once the patient is checked in, he or she would have a seat in the waiting room until they're called to the back. So we now have, and you might be able to see here, we have one side that is medical, and then we have another side that is dental. We'll go back and look at what our rooms look like. But we would only have one medical provider here at any given time. So we have 3 medical rooms that the volunteers can toggle between. Typically our volunteers are here for a half a day, sometimes a little bit more than a half a day. And sometimes we have clinic in both the morning and the afternoon, so it'd be 2 different providers, but only one provider here at any given time. So I'll take you back there and show you the rooms. This is one of our medical rooms. When you come in, it looks very much like a medical room. We have 2 rooms that are set up this way that we see patients in. And then we have another room that we do not have a bed in, because sometimes we use that. We have a chiropractor that occasionally comes and he has a table that he needs to set up. And so we leave that room sort of as for different specialties, and we can set that up or tear it down as we need, but these rooms stay the same. When you come back down the hall, that was our clinic manager peeking around the corner here. That's Crystal. This is where the doctors and the volunteers would sit back here doing their medical notes. If they need to call Ascension or Aurora and make additional appointments, or ask for, well, consult with another professional, they're able to do that back here, but it's sort of back and away from everything. And they can see the 3 exam rooms that we have right down this hallway. Earlier today, I said that one of the things that we do is help with medications. And so we take donations of medications. Everything must be sealed and not expired, but we do take donations. And then we also purchase medications that I can purchase for cheaper than I can buy at some of the local pharmacies. The prices of medications change on a daily and literally on a daily basis. Those prices change. And so we have a couple of staff members that monitor that every single day, what we can buy for cheaper than we can buy with one of our partner pharmacies. Typically speaking, what we keep on our shelves are some of the more generic drugs, some of the less expensive drugs, but they would be mostly for diabetes, hypertension, asthma, those types of chronic conditions that where we can purchase them. If a patient needs a prescription, we're able to fill it here. If they need a prescription of something that we don't have on our shelves, we work with 16 different pharmacies across the county, and they provide a healthcare network price. And we have to call many of them to see what the price of the day is, because like I said, literally they change. And then let's say the price is $10 for a month's worth of medication. And if the patient can pay maybe $5 of that, then we'll write a voucher for the remaining $5. We send that with the patient. They take that to the pharmacy, they get their prescription filled. At the end of the month, that pharmacy mails back that voucher to me, and I cut them a check for that. So what we spend our money on, since our program is usually provided by volunteers, we spend our money on the staffing, and then we also spend our money on medication. So that's a huge piece of our budget to provide the medications. If we had the doctor or the dentist, without the medication, that care would not be provided, and we wouldn't have people that would be able to meet their health outcomes and sustain a good sustained wellness. And so that's an important piece of what we do. So this is our room, and it changes on a daily basis. And then we'll come through to the other side of our building, where we have a lot of, it's mostly administration offices. We do have our therapist that sits back here. Also, again, she's Spanish speaking. She is able to see any of our patients for ongoing therapy. And then we do have a social worker. We have social work interns that work closely with our therapist. So we do provide the resource allocation, social services, and then the therapy piece for our patients. This is our dental lab. We have 2 dental operatories, and this is where we do all of the cleaning of the instruments that we use for dental. We do have other dental things that we do here, so I know that does not sound official, but this is the lab where all of that takes place. And then our dental operatories. When we moved into our new building, we were able to buy new equipment. Our old equipment was old in 2005. So we had used that as much as we could use that. And now we do have new equipment. So that is a good piece of what we have. So our dentists come in. They will sit with, we employ a dental assistant. And so she's able to assist that dentist. And then we also have a dental hygienist on staff too. And they can toggle, that dentist can toggle between those 2 rooms, and the dental assistant works with the dentist to be able to provide that care. We did at one time not have a dental assistant on staff. And what ended up happening is we couldn't get enough dental hygiene volunteers to volunteer for us, but we had lots of dentists. And what would happen is the dentist would do their work, but we didn't have the hygiene piece of it to be able to maintain that dental work and to be able to do the preventative care for our patients. So we were able to employ a dental hygienist on staff who now works with our dentists to be able to do that. And again, our dental services take place just like our medical services on site or in the office of the dental provider across the county. And again, we have another dental office there. They are full service. We can do x-rays. We can do any kind of procedures here. So it's a total full service dental office that we have. And then that takes us right back up to the front. Going again past the healthcare coordinators and back to the front of our office. Okay, all right. So I will head back to my office now.
Thank you, Allison and Julie, for the tour. I think it really, it puts it into perspective and, provides that larger picture of all the services that Healthcare Network is able to provide to our community. So we will jump into a Q&A portion. I know we're over the half-hour mark, so I know if you have a meeting or something to get to, by all means, feel free to jump off. Otherwise, stick around, and if you have any questions or just even any comments for Allison, we are happy to hear them. So I didn't see any comments come in the chat box. I think someone did leave a comment. Okay, I'm just looking. Such excellent work. Thank you for supporting our community and providing access to services with dignity and professionalism.
Thank you, Jessica.
Yes, does anybody have any questions for Allison or the team at United Way? If not, and if you've come up with a question maybe later on, feel free to contact us or Allison. If there's some information that maybe we didn't cover. Dan from the food bank, wonderful agency doing essential work. Thanks to UW for organizing these tours, very informative. You're very welcome, Dan. So with that, since if there isn't any questions coming through, and we are a little bit over the half hour, I definitely want to thank Allison for volunteering to do this. And showing us, the important work that they're doing within the community. I will add my own personal note that years ago when I was uninsured, I did come to the Healthcare Network and they were able to help me get the services that I needed at no cost. So I'm very appreciative of the Healthcare Network and the services that you all do for the community. So thank you.
Thank you.
Yes. So with that, I know we have some calls to action that Allison kind of put out there earlier, and I'm going to share a slide before we close out about what you can do to really help the healthcare network, right? So again, you know, the call for volunteers, looking for someone to help with the digital files, and then also that call to action of, you know, donating soft bristled individually packaged toothbrushes, the toothpaste, and the dental floss. Again, you know, feel free to reach out to Allison, you know, in the coming months or weeks, if there is something else that you are willing to get involved with. But yes, so with that, I will close out this impact tour. But before that, I just want to share with all of you, we are doing another impact tour next month. So the month of August, on August 18th from noon to 12:30, we will be visiting the Arc of Racine. So we look forward to learning more about their work. And yes, so look for that invite that should come out next week, early next week. So check your inboxes, and we hope that you can join us then. But again, thank you, Allison. It's a pleasure always talking to you and learning more about the work that you're doing within the community. So.
There you go. Thank you very much. Thank you for taking the time and for coming in to see what Healthcare Network is all about.
Great. Well, everyone enjoy the rest of your afternoon, and you should receive a follow-up email, so look for that as well. All right, thank you all and be well. Bye now.
Bye.